So our question today is, where does digestion start? And I'm seeing a lot of people write the mouth, which is a great answer. And it's actually my first answer when I thought about this question. And on second thought, it made me realize that we also have our olfactory senses, so our smell. So digestion is very complex. And as we go through it today, you guys are going to realize this interplay that happens between these organs. And it could be argued that digestion actually might start with the smell. And that sends a signal to our stomach to start to produce these acids, as well as our saliva in our mouth, which may be, arguably the first organ of digestion, being the mouth itself, where we have amylase and other enzymes coming in. So thank you guys for participating in that little brain exercise there before we get started. So today we're going to be talking about digestion, ways to improve our digestion, and really getting a good understanding about irritable bowel syndrome, IBS, which many of you have heard about, and SIBO, which is small bowel intestinal overgrowth. And we're going to go into that in detail. So our care team at Prosper Natural Health includes myself, Dr. Molly. We also have Dr. Rosalie and Dr. Mary, who are all here with us today. And we are just so excited to blend our combined information for our patients and for our community. We all three come together as naturopathic physicians, and Dr. Rosalie and Dr. Mary have extra training in Eastern medical models. So Dr. Rosalie has an Ayurvedic background in East Indian medicine, and Dr. Mary has a Chinese medicine background with acupuncture paired with that. So what we want to really create, not just for our doc talk today, but also in our clinic, is a space where we're looking at the holistic picture for the patient and using these different tools from the different models that are very effective and have been used for many, many years, a lot of them, and really blending those for the individualized patient and making sure that each of us are really able to benefit from that more holistic approach. So in naturopathic medicine, of course, we're trying to really treat the root cause. So one of the important reasons that we do these doc talks is we want to educate you in regards to what can go wrong with your health and ways to empower you to find that balance again. So today our goals are really to talk about what is healthy digestion, how does it work, what's the physiology behind healthy digestion, how it impacts your overall health, and then we want to go into ways that we can really investigate what is going on with digestion, quantitatively measure it. You're going to find that at least here at Prosper, we're pretty scientifically based. And we want you to have ideas of ways that you can really monitor your digestion. And then, of course, we want you to walk away with tools to really support your digestive health. So we're going to give you some of our favorite health hacks for the digestive system today. So once again, if you have questions that come up, put them down in the chat. We're going to kind of move through this information quickly because there is a lot of really complexity to the digestive tract. And this is actually my very favorite topic because it's so very humbling as a physician to be able to say, oh my gosh, this is a very complex system. There's a lot of interplay that can happen with the digestive tract. And it's very rewarding as well to help somebody fix their digestive issues, rebalance their digestive system. We call the gut the root of our health. So it's so very important to make sure that we have healthy digestion. Our body is constantly sending us signals. We can utilize those signals to learn those clues that our body is having issues or imbalances happening. So I want you guys to just take a quick second before we start to launch into a lot of the chemistry and how the organs work together and all of that, and think about some of the most common signs that your body might be sending you. So this can be something as simple as loose stool or gas or bloating, or it could be something like constipation or abdominal cramping. So all of those are fairly common signs that our digestive tract can send us. And at some point in our lives, most likely we have some imbalance that can happen, and some of those signs happening. So think about those. And as we go through the normal physiology today of digestion, think about yours specifically and where some of those imbalances may have occurred to have your body sending you those signals. We always like to really emphasize how important our body's communication with ourselves are. So we're going to start with how it works and where it starts. So we talked about the mouth being, our first organ of digestion, but actually the nose is going to sense the oncoming food first. So it starts as the nose signals, the smell signals this secretion of digestive enzymes. So this is a neurologic activity now, and then it goes down and affects the nerves in the GI system to help, and in our mouth to help with these digestive enzymes being released, number one. Then we have the mouth. Of course, we've got the mechanical action of chewing and breaking down our food, and we're going to figure out why that's so important here. And then we have the saliva, and the saliva is doing two mechanical things here. First, it's actually lubricating the food. So that dry popcorn that you eat doesn't get stuck in your throat. We have to have that saliva lubricating that food to bring it down as a bolus or a nice chewed clump down our esophagus. And then we also have these enzymes, specifically amylase is a big one. It's a starch splitting enzyme that's released in our saliva. So we really want to coat that food initially in our mouth and start to break it down in our mouth, so that we got that good covering of that saliva. We get that mechanical action on the small level from the enzymes and on the larger level from our teeth. When we talk about the stomach, we're going to talk about how small that little pyloric sphincter is, and it's about 5 millimeters, so pretty small. So when you think about chewing and swallowing big chunks of food, it leaves a lot up to your stomach if we don't get that mechanical chewing action. So one of the things that really floored me in naturopathic school when I was in med school was learning that we're supposed to be chewing our food somewhere between 25 and 30 times prior to each swallow. So coming from a household where we would just horse down our food as quickly as we could, this was kind of a shock to me. But if we're having digestive imbalances, we really want to make sure we're giving the body all of the support we can. So think about those basics. Think about making sure we can smell the food coming in, getting our body prepped for it, taking that extra minute to enjoy the food that's in front of us, and having that neurologic release, and then chewing. So then we've got our esophagus. Now, our esophagus is essentially this tube, right? But it's this tube that's lined with muscles. And these muscles are going to contract and make this, we call it a peristaltic movement. And what that's doing is it's pushing down that food. Now, we've all felt that every time we've gone to swallow, we feel this food traveling down if we take a second to think about it. It also reduces the size of that food bolus or chunk of food as we're doing that. And then we're going to have two important sphincters, so closing mechanisms on our esophagus. We have one at the top and one at the bottom. So an upper and a lower esophageal sphincter. And these are important because if we have damage to those sphincters, then we can have food going the wrong way or not traveling down correctly. So if we have a constriction at the top, we might not be able to swallow well. So we start having our patients coming in saying, I can't swallow these tablets. I can't swallow this food. I'm having a harder time swallowing things like meat and that are more solid foods. Or if we have a problem with the lower, we have issues more with reflux food that's coming up from the stomach that's supposed to be down and settled, that's coming back up. So we're going to talk about that today as well.
The next organ of digestion is that stomach. And again, it's a big muscular organ on that left side of the body, kind of covered by the rib cage underneath the lungs. And this is where we are going to be seeing a lot of digestion starting to happen, secretion of hormones and proteins that help with breaking down. So, you know, this muscle bag sort of churns and physically breaks down food, but it also, as it churns, will secrete a bunch of hormones. So the food enters from the esophagus through the pyloric sphincter, that valve at the bottom, into the stomach, and then the body notices that, secretes a hormone known as gastrin. Okay, and gastrin is really important because once gastrin gets released, then the stomach acids get released, which includes specifically hydrochloric acid, okay? The parietal cells are the specific cells in the lining of the stomach that will release this acid. The stomach, as we eat more and more, will enlarge mechanically, and that is also another trigger for extra support, that more acid gets secreted, that HCl, hydrochloric acid, as well as pepsin, which is really important for digesting proteins, okay? So those parietal cells that are lining the stomach not only secrete those hormones, they also secrete a really important protein known as intrinsic factor. And if this might be something you're familiar with, because intrinsic factor binds to B12 in foods and allows us to absorb that B vitamin that we otherwise don't make in the body. And so that stomach acid has three main functions. Obviously, it enhances the absorption of nutrients and foods. It digests proteins, but the biggest one that often gets forgotten is that this stomach acid, which is between the pH of 1.5 and 3, which is pretty acidic, it kills bacteria, pathogens, and microbial invaders, okay? So if we're eating food and the stomach acid is not acidic enough, we actually, one of our barriers, that barrier that prevents us from getting ill, that stomach acid, that becomes problematic, and we can have an overgrowth of bad bacteria. So moving back down to the bottom here, the absorption of nutrients, what I talked about earlier, is helping with the B12, but also other B vitamins, okay? As food makes its way down to the bottom of the stomach, in the sort of the area close to the small intestine, which is the next step, it acidifies the next step of digestion, and that's very important for a lot of our mineral and vitamin absorption. In terms of gastric emptying, this is an important term that tells us about how much time it takes from the food going into the stomach and leaving the stomach for the small intestine. How much time that takes is what's known as gastric emptying. And it's about 1 to 5 hours, depending on the food. 1 hour would be maybe, you know, some pretty easily digested fruit. And 4 to 5 hours could be our hard to digest meals, the ones that contain dairy, that are very high in protein, that are very, very, very fatty, okay? Those take a while to digest because it takes a long time for the body to fully break those down so that they can be absorbed. Peristalsis, as Dr. Molly talked about, is that motion that goes one after the other. to move the food through the digestive tract in the correct direction. That happens all throughout the digestive tract, but also especially in the stomach. The migrating motor complex is a really interesting biological phenomenon in the lining of the stomach and the rest of the GI tract, where there's little fingers that help move things along gently, okay? And if there's issues with these fingers, you could imagine that food just sits and starts to ferment, okay? And so this is really important to keep in track of when we're talking about things like SIBO and IBS. There's also hormones that delay that gastric emptying when they're noticing, wow, we've got a lot of dairy in this meal, right? They're going to secrete hormones like cholecystokinin, okay, which tells the organs further downstream, all right, there's a high fat, high dairy meal coming, get ready, okay? Same as hormone gastric inhibitory peptide. It's telling us, hold on, we've got to digest a little bit longer here. As Dr. Molly mentioned, that pyloric sphincter is also a key piece of the digestive tract. It's the junction between the esophagus and the stomach, okay? Just 5 millimeters wide. When it notices food coming down, it relaxes and opens and closes right back up, okay? A lot of issues can happen when that pyloric sphincter doesn't close well or doesn't open well. I'll hand this next section off to Dr. Mary.
Mary, I'm sorry, I can't hear you or see you, actually, very odd. So maybe I will take this slide if you want to try to log back off and back on. Unless anyone else can see her, Rosalie. No? Okay. Yeah, we'll have her log back off and on. Good old Zoom, always, you know, keeping us on our toes. So the next section here is our small intestines. And you guys have heard, of course, of your large and your small intestines, but the small intestines are very overlooked by a lot of folks. You know, when we say intestines, people are usually thinking more of the large intestines, but they are 20 feet on average in length. So they're pretty massive. And they have in them these villi and microvilli, which basically are these finger-like projections that help with absorption. And there are 3 specific parts, and this is helpful for us as physicians to know what is going on in these 3 different areas. So we have the first part, which we associate more with digestion. We have the second part, which is more the jejunum, which is more absorption. And then the ileum is also more of an absorption space. So we think of like mechanical breakdown more in that duodenum, or the duodenum, however you want to pronounce it, in the first portion, and the second 2 being more about the absorption piece. So let's see if Dr. Mary is, I see her now. Can everyone see her?
Can you hear me?
Yay, it worked. We love it when Zoom works.
All right. Well, my apologies. I missed that last piece, but I'll just move on ahead here. So there's a number of different ways that we can break down food in the small intestine. And one of them starts on the intestinal wall. So we have an enzyme called secretin. It's a hormone that stimulates liver and pancreatic secretions. And then we have disaccharide enzymes. And these are how we break down some of are smaller sugars, and smaller carbohydrates, so things like lactase and sucrose, or lactose and sucrose. And then we've got bile salts, which you can kind of imagine the way a soap is able to emulsify fats. Bile salts act in a similar way where they kind of engulf the fats and break them down into tiny, tiny particles. And this aids in the absorption of fat-soluble molecules. So really important for the absorption of vitamin A, D, E, and K. And then we have also got pancreatic enzymes. So these are probably, like Dr. Molly explained, produced by the pancreas, and they come out of a little hole that go into the duodenum. And in the next slide, we'll talk more about these pancreatic enzymes. So here's just a great image of where everything is absorbed. And it's very extensive, so we won't talk through all of it, but it just gives you a sense of the complexity of this digestive system and how it's really important to have it all functioning, because there's key nutrients and vitamins and macromolecules that are absorbed in each of these sections. So that's a good one to go back and look over later because it's really fascinating. So here's a list of the pancreatic enzymes. And as you can see, so here from the duodenum, we've got the start of the breakdown of proteins, amino acids, RNA, DNA, fats, cholesterol, starches. So all kinds of things that are being broken down into usable parts in that section. And this really highlights the importance of having these digestive enzymes, particularly the pancreatic enzymes. And so promoting our proper neurological function and coordination of all of these enzymes with peristalsis becomes really important. And when we don't have the proper enzymes that we're secreting ourselves, we're often supplementing with digestive enzymes in a supplement form. And one more piece that's really important here is that you need to break all of these, particularly proteins, down into smaller parts so that your body is less likely to react to them. The larger the molecules, the more our immune system goes, hey, that's something crazy and abnormal, and we need to react to it. And so that's more likely to cause sensitivities to particular foods. So this is all important for both absorbing those nutrients, but also kind of keeping our immune system and our immune reactivity in check. All right, so here we get to the large intestine, and this is where we're absorbing water, electrolytes, and some vitamins. We have over 100 trillion bacteria in the large intestine. This is where the majority of our microbiome resides, and they actually help us harvest many more nutrients, particularly vitamins and fatty acids that are important for our intestinal lining that we're not able to digest ourselves. And of course, this is where we start to eliminate waste and remove all of the things that we can't use out of the body.
So when something goes wrong in the digestive tract, there is, this theory known as the leaky gut theory. It's a syndrome. It's kind of hard to diagnose. It's not really a diagnosis, but it's definitely a theory that talks about when the GI tract has intestinal permeability. Okay, which means the intestinal tract is not nice and protected. It's got essentially holes in it so that food particles that aren't fully digested are leaking out into the rest of the body. Okay, what's really important in the GI tract is that there is a mucosal lining, okay? Which means there's some nice protective mucus around this digestive tube that prevents food particles from going through the cells of the intestinal tract. When the cells sort of spread apart due to infections or alcohol use or even some medications, there's a lot of things that can lead to this, food sensitivities, gastric inflammation, et cetera. When those cells will split apart, that mucosal lining basically also splits and lets those premature food particles through. And that's problematic because it can lead to symptoms that are all over the place. So the next slide has those things. These symptoms can include things like heartburn, diarrhea, constipation, abdominal pain, gas, burping, bloating, and even abdominal cramping, things that tell us, okay, GI tract is not working optimally. Okay, it also predisposes us or can be caused by infections, including H. pylori, which maybe you've heard of because it's a big one in terms of it navigates its way through that mucosal layer and digs into it and can cause an ulcer. Okay, other bacteria like foodborne illness can cause that leaky gut, hence why we get diarrhea when we have foodborne illness. Viruses as well, stomach bugs, fungus overgrowth, such as candida in the GI tract, parasites. Basically, this just talks about the microbiome, right? If we've got a nice biodiverse garden in our GI tract, that microbiome, it helps us with digestion. If there's a monoculture of one of these families, the digestion is going to be impaired and contribute to leaky gut. So moving right along to IBS, irritable bowel syndrome. It is a diagnosis of exclusion, which is a curious term. It tells us about the fact that as diagnosticians, we have to rule out everything before we can say, okay, we've hit the nail on the head, you have IBS, right? Which means that we've got to make sure we rule out other common causes of abdominal pain, which include foodborne illness, which include food sensitivities, etc., which include low stomach acid, right? So once we've done that diagnostic workup, we can label it IBS, right? Nothing else fits, but you're still having abdominal pain. It could present in a lot of different ways, okay? It can be dominance of diarrhea, of constipation, or one or the other, even in the same day, okay? The biggest piece here is that there's abdominal pain that's made better with bowel movements, okay? The bowel movements might still feel nonetheless inconsistent or, don't have a great consistency in general. They don't look like nice bananas, but all of that together is what helps lead to the diagnosis of IBS. And so constipation is one of the types of IBS. Okay, there's 3 types, like I said before: diarrhea, constipation, or mixed type. So chronic constipation can be very much labeled as IBS, but what's really important to remember is that there's another diagnosis here that looks similar to IBS, but has a way to diagnose it with a breath test, and that one is SIBO, which Dr. Mary will talk about next.
Great, thank you. So SIBO, small intestinal bacterial overgrowth, is it's a kind of popular diagnosis right now, and largely it's because over the last 10 years or so, we've gained a lot of understanding of what it is. So a lot of these people that were just diagnosed with IBS as the diagnosis of exclusion before, we now know that they have this particular issue happening. And it's so SIBO is an overgrowth of bacteria in your small intestine. As I was mentioning before, it's natural and normal and vital for you to have this vast microbiome in your large intestine. But we want some microbes in our small intestine, but not many. And when the small intestine becomes colonized with an overgrowth of these particular gas-producing bacteria, it causes a lot of discomfort. So that brings us to the symptoms of SIBO. So the abdominal pain and discomfort and gas and bloating, and this can lead to the flatulence and burping. And we also have diarrhea and constipation, or both. And as I'll discuss in a few slides, there's a couple of different gases that different species of these bacteria can produce. One of them is hydrogen, one is methane, and one is hydrogen sulfide. Those are the three main gases. And whether or not you have a predominance of certain bacteria or others, they'll produce more of the hydrogen or methane or hydrogen sulfide, and each are associated with a different type of, are associated with either diarrhea or constipation. So hydrogen and hydrogen sulfide dominant SIBO will lead to diarrhea, while methane can actually work on the lining of the intestine and slow motility, so it leads to constipation. So we also can have indigestion and nausea and heartburn, and a lot of this is just from the pressure pushing up on your stomach from the small intestine with all of that gas. And then fatty stools, we're gonna see a decreased absorption from in our intestines from all of this overgrowth of bacteria, and that can lead to these kind of floaty, greasy looking fatty stools. All right, so we see, you know, when you've got gas and bloating and are wondering whether or not it is SIBO, some things that tip you off to the fact that it is SIBO are if you have a dramatic improvement of your symptoms after antibiotic treatment. So that can be any types of antibiotics and also herbal antimicrobials that we'll discuss later. You can have worsening of GI symptoms with probiotics or prebiotics. So those things that feed all those bacteria, you don't really want them there if you've got this huge overgrowth already happening. So kind of what's healthy for you to begin with becomes problematic if you've already got SIBO. And then you can have worsening of constipation with fiber. Again, you're having this, normally fiber helps, but if the methanogenic bacteria are causing more constipation, then that is gonna make things worse. And then often there's a common pattern where after people have surgery or major pain event, then they need to use opioids. It will slow your gastric motility, and that leads to that buildup of bacteria, and you get this chronic GI gas and bloating after that. So there are many conditions that are associated with SIBO, and a lot of these are ones that are going to impact the movement of food and bacteria through the small and large intestine. So they can cause these kind of scarring patterns and strictures and prevent the smooth and important movement of things through the intestines, again, leading to that buildup of bacteria up in the small intestine. So that can be things like endometriosis, ulcerative colitis, Crohn's, where you get the kind of chronic inflammation and scarring. And then we have a lot of conditions that are associated with nervous system dysregulation. Again, that motor or migrating motor complex is really important for the proper functioning of the digestive system. So when you have things like diabetes, which can affect your nervous system, fibromyalgia, Parkinson's, and even migraines, you can have this sudden shutting down of the migrating motor complex, which will throw all of those dynamics off.
So with the risk factors for SIBO, Dr. Mary just talked about how if we have that stool being stagnant and we have the overgrowth of this bacteria as a secondary problem from that, there are all kinds of things that could happen in your day-to-day life that might be the original trigger for SIBO. And what we see quite a bit in our practice is this, people who say, I've had this for, 10, 20 years, and they have a hard time pinpointing exactly even when it started. But one of the most researched reasons for SIBO is from food poisoning. So that makes sense if you think about the mechanical organ system that we just talked about. Anytime where you have this pressure system where if you're vomiting or having very fast exiting of the stool, like you do with food poisoning, with that gastroenteritis, it can cause flora from your large intestine to reflux up into your small intestine. And that's not great, because that's where we start to have this setting up of the shop of the flora that really shouldn't be there in inappropriate amounts. And sometimes they like to have a party there, and it can cause, this large increase in the microbes there that are inappropriate, and we get SIBO. So we also see these structural or anatomical issues cause it. There's research that shows that certain surgical adhesions can cause it, or even post-surgically from use of opioids, which slow our motility. So we have more constipation. The bacteria is just sitting there in our large intestine that can literally reflux back up into the small intestine. Anything with those motility disorders that Dr. Mary had just discussed. And also we know that if we have poor digestive function because of low enzymes, starting from the very beginning with that smell stimulating our digestive enzymes and our mouth stimulating that breakdown of those foods with those digestive enzymes, those can affect our flora amounts, because really our gut flora is designed to be fed certain things and certain areas of our digestive tract. So if we have bigger proteins coming through, bigger amounts of food particles than we're supposed to coming through, then that's problematic for who we're inviting as far as our flora to set up shop. We also know stress is going to be a big one. We're going to talk about this more when we talk about our vagus nerve. And as we age, we know motility is affected. So our ability to clear our stool through. And then obviously certain medications can affect that. We already talked about the opioids, but we know that our acid blockers, like what we use in reflux, acid reflux, and GERD, like our PPIs or omeprazole, the little purple pill, these kind of things can really block our ability to have the right pH for our food. And so we get a major disruption of the pH in our small intestine, and that can just be an invitation for problems for flora. So let's talk about how we evaluate this, because the story has been repeated so many times for my patients that come in. And I'll tell you, SIBO is a newer diagnosis, at least for me, having, gone through medical school about 20 years ago now. It's been pretty wild going from learning that, these people have IBS to actually about 80 to 90% of them actually have this small bowel intestinal overgrowth. And even when I went through school, we were told there are no microbes in the small intestine. So even that narrative has changed now with more science and more understanding of microbiology and the microbiome. So Now, I'm going to invite you guys to look back to those symptoms that we were talking about in the very beginning, those signs that your body are telling you, and think about how those symptoms might be impacted either physically from structural changes or things that are going on with your own pH. Think about how they might be affected biochemically for you. And that can be even affected by emotional components too. So we know that biochemical component, as far as the digestive enzyme release and all of that, can be really hindered by things like stress as well. So take a second and just kind of pair those little signs that you have. Maybe it's constipation, maybe it's gas, whatever it is, kind of see if you can pair those with, is this a physical problem for myself? Is this a chemical problem for myself, not making enough digestive enzymes? Or is this a mental emotional sphere? I'm going to pass it off to Dr. Rosalie to talk about poop, my favorite subject.
Thanks, Dr. Molly. One of my favorite ways in naturopathic medicine to evaluate how the GI tract is doing, how we're actually digesting, is a stool panel. So it's pretty easy to do. It's just, you collect a stool sample, just about your a walnut size amount. We send that into the lab, and then it comes back with a report that is very comprehensive, that tells us about all of the specific microbes that are growing either in an overgrowth or in an undergrowth, in a biodiversity or in a monoculture. It also tells us about inflammatory markers, which are really important to look at, especially when there's GI things that are not easy to diagnose. We're not quite sure what's going on. We've got to make sure that we rule out gut inflammatory syndromes like IBD, Crohn's, celiac, etc. So that's really important in that stool test. And the third big piece of the stool panel, it's probably my favorite part of it, is the section that tells us about digestive power. It tells us about whether you're secreting pancreatic enzymes, whether you are secreting a protein that contributes to leaky gut, known as zonulin, okay? And so the next slide actually has a visual of just half a page of this 6-page document that tells us about what's going on in the GI tract from the stool, which is the exit point, right? One of the big things too that this test does for us is it breaks out what are the pathogens. So it looks actually at DNA, looks at microbial DNA, and it breaks it out in terms of how many pathogenic bacteria are present, okay? It also breaks it out in terms of which are the helpful microbes that are present, and are those lacking, right? And are those in a poor ratio? And once we see this data, there's a lot of tools from the naturopathic perspective that can help with correcting this biodiversity in the microflora.
So another diagnostic tool that we have is the breath test. And this is what we use the vast majority of the time when we're concerned about SIBO. It's a relatively easy test to do, and it takes 2 to 3 hours at home. And it's one where you're blowing into tubes after taking either lactulose or glucose solution, and then as you digest those sugars, and then blow your out breath into these tubes contains a certain percentage of gases, and that tells us what proportion of certain types of microbes you have in your small intestine and in your large intestine. So here's an example of a sample result and what we're looking for. So as you can see here, the idea is you do a breath sample every 20 minutes for 180 minutes. So giving your enough time for the full transit time through your digestive system. And what we're looking for is a spike in hydrogen gases or methane gases. And then there's a third one now that just came out within the last year, which is really exciting, called the hydrogen sulfide. So we can also look at that. And that's telling us, again, this gas production is connected to specific microbes in the large intestine. And it kind of gives us, it's the sort of secondary clue that allows us to decipher what's happening and then which treatments are going to be the most useful in terms of getting rid of that bacterial overgrowth. So there's also the option of diagnostic imaging. This is not for the purpose of SIBO. We don't do that. We don't use this option as often because it's invasive. But if you have ongoing other digestive issues, whether it's GERD, pain in the esophagus, diarrhea, long-term constipation, we always want to rule out concerning diagnoses. So we can go to endoscopy, which would be sending a scope down into your esophagus and upper GI tract. We can do colonoscopy, which most of you are familiar with, where we send a scope into the colon. And then in terms of SIBO, diagnosis, the gold standard is actually taking an aspirate or a little sample of the microbes that are in the small intestine and looking at those and getting the more concrete analysis of those microbes in the small intestine. However, again, this is not commonly done because it is quite invasive. But what's really nice is that in the last year, they've done studies that have shown the correlation where they've looked at these aspirates in a wide variety of people and correlated them to breath testing. So there's a good understanding that that the breath testing is a rigorous diagnostic tool that's been vetted in the scientific community. So that's really helpful for us as clinicians.
So let's talk about ways that we treat SIBO, small intestinal overgrowth. So in our clinic, we use whatever is appropriate for our individual patient. That being said, the standard of care for SIBO treatment is the use of antibiotics or antimicrobial herbs. So we can use these in combination with each other, which is our preferred method here, just because it's very effective, or we can use them solo, either only the antimicrobial antibiotics, the prescription drugs, or only the antimicrobial herbs. The antibiotics are typically given for 14 days. The antimicrobial herbs can be given for up to 90 days. They can take a little bit longer to be as effective. There are great published research papers regarding both of these and the use of them in combination. In our clinical practice, we tend to recommend the use of them in combination, like I said, because it just is more effective for patients and it's usually a shorter duration. And then we can start working on getting their gut flora back up to normal. When we're using these antimicrobials, we want to use something called biofilm busters or biofilm disruptors. Biofilm is essentially this protein network that microbes will make around themselves when they get up to a certain colony size. When they overgrow to a certain amount, they can produce these cool proteins that protect them. The problem for us as humans is we want to be able to penetrate through that biofilm so that the antimicrobials can kill the overgrowth of bacteria. So a lot of times we give specific enzymes that help break up these biofilms, because when we have these major colony blooms in the small intestine, we want to make sure that biofilms aren't protecting against that. And we're, essentially it would be a waste to give those antibiotics or antimicrobials at that time. We also want to give something to support the migrating motor complex. That's the MMC you'll see in this presentation today. That is helping us move the stool mechanically. We do not want the stool to sit and ferment and back up. That is the opposite of what we want in SIBO. We are trying to move things through and recolonize. We also usually are recommending a very specific diet for our patients. Typically, for our practice, we have modified the specific carbohydrate diet. Sometimes we'll be introducing a low sulfur diet if the person has hydrogen sulfide that we find in their breath test. We also sometimes will have to engage in something called an elemental diet, which is a very stripped down bare bones diet where we're reinitiating the gut flora kind of from the ground up. And then you guys may have heard of the low FODMAP diet. Now, FODMAPs is standing for a whole mouthful here. So it's fermentable. So we're talking about things that are fermenting, these bacteria in the bowels. Oligosaccharides. So now we're talking about different sugars: oligosaccharides, disaccharides, monosaccharides, and polyols. Now, polyols are alcohol sugars. We see these a lot in things like erythritol, sweeteners, xylitol, those kind of things, sorbitol. Now, these are carbohydrates that come in our food, these FODMAPs. And a low FODMAP diet has become incredibly popular for gastroenterology and standard conventional gastroenterologists, because reducing the amount of these fermentable foods in the gut allows people to have less of that gas and bloating, because we're not feeding the flora that's imbalanced in the small GI. So you can see how just limiting the amount of food for the flora can reduce people's side effects and either their constipation, diarrhea, or gas production overall. So this is a standard kind of chart that people will sometimes use of less fermentable foods on the scale to the red zone, the more fermentable foods. We find that these more fermentable foods, kind of the classic one in our practice is from the onion family, like garlic and onions. Those will usually spike this bacterial growth. And as a side effect, remember, when the bacteria is growing, some of these bacteria are producing large amount of gas, and that gas is what can cause the pressure or slow gut motility or speed gut motility, which means diarrhea or constipation, whichever way the flora is, depending on the flora's gas, which is one of the reasons why we love that breath test, is we can figure out what gas this flora is predominantly making and figure out which antimicrobials can be chosen for that. So after we have given the antimicrobials and we've given some disruptors, enzymatic disruptors for that bacterial biofilm, and we've changed our diet, so we're kind of reducing the amount of fermentation that's actively happening. So we're not feeding the bad flora or the inappropriately growing flora with SIBO. Then we want to start adding back in our flexibility after our antimicrobials are done. We want to regain our intestinal biodiversity. That biodiversity helps us from going down this pathway again. It's protective for us. We know the more diverse gut flora we have, the better health we have. So, and this is shown across the board with chronic diseases. So we really want to regain our diversity. And so slowly over time, we are intentionally adding back in our fermentable foods and our carbohydrates very slowly and intentionally. And we're doing this on an individual basis with our patients. There's so much that contributes to how quickly and which foods can be tolerated when.
So irregardless of whether you have IBS or SIBO or you're suspicious of that, we've got 7 health hacks to introduce you to either, to help with your digestive symptoms in general, or that can very much help with those 2 diagnoses we just discussed as well. So the first one is to dial in your diet. So of course, food is medicine, and certain foods are medicine for some people, but can be problematic for others. So ultimately, this is where the medicine becomes very individualized. if we're going to dial in the diet, it's got to start at the start, at the beginning of digestion. So our next slide has that. The one of the biggest things we can do is to pre-digest our food. So this is where maybe my viewpoint differs a little bit, because I feel like digestion starts actually on the outside with our probiotics, essentially. Our mechanically pre-digested foods, our smoothies that have been broken down on the outside, right? Or our ferments that have been chemically broken down by our fermentables, right? So once we've got that pre-digestion that's happened, we can introduce that food and chew it thoroughly, because that chewing with our teeth stimulates the saliva. That is the first place that we're going to be digesting carbohydrates. So if you've done any fermentation in the past or made beer, for example, you know that to grow things, to ferment things, they need carbohydrates, they need sugars. So if we are digesting our sugars outside the body and in the mouth first, we are going to prevent those sugars from going through the body and fermenting later on if there's poor digestive fire, okay? One of the other things we can do is to avoid watering down our foods with our main meals, because if we water down our foods, our pH goes up, right? And we want to make sure it stays nice and low and acidic. It's really important too to give some space between our meals so that our GI tract can fully do its work and gastric emptying can happen successfully. This also includes avoiding eating right before bed, okay? Because once we lay back, then, you know, gravity is no longer on our side. Things can move around in the wrong order. And this last point here, lunch being the biggest meal of the day, that's very much from the Ayurvedic perspective, which is our traditional medicine from India, that says when the sun is highest, your heat internally is also the highest. So your digestive fire is the highest, which is something that, you know, seems a little counterintuitive in our Western world these days. So one of the other tests we can do to check in on the GI tract and whether you individually are sensitive to certain things you're eating is a blood test that looks at food sensitivities, okay? And it can be up to 184 different types of foods that are tested, and what's specifically measured is your immune response, your own body's individual immune response to various things, from cow dairy to shellfish, right? So if we see an immune response, it tells us the body is attacking that food, causing inflammation, and it's not playing nice and causing GI tract symptoms. So that's really important to exclude as well. If you haven't had a blood test to check in on your individual food sensitivities, it's worth thinking about. If we want to calm down that GI tract inflammation, we're talking about foods that are easy to digest and that are non-inflammatory. So this list includes those foods. We're thinking of bone broth, really healing, seaweed products that help contribute to the mucus lining, okay, that helps prevent inflammation, whole fruits, non-starchy vegetables, etc., etc. So you can review this list on your own terms. Foods to exclude, I know we've talked about a bit in the previous slides. Alcohol is a big one. Alcohol contributes to leaky gut. It's something that we forget about. Alcohol will also prevent B12 absorption, okay? So these foods on this list are things that promote inflammation. They promote, they promote basically a non non-diverse microflora, and can contribute even to leaky gut. If you've got sensitivities, food sensitivities to these, it's an added piece for you individually. Gluten's on here as well because it's a hard to digest protein. And I know this is a big buzzword right now, but gluten is just one of those proteins that the human body in general, has a hard time digesting. You need a very strong internal digestive fire to fully move it through the body, which is not common in a lot of the Western world.
Okay, so real quick here, we'll talk through prioritizing movement. It's good for your health in general, but particularly for your digestive system. It's really important. And one of the reasons that we're doing the flexibility, core, strength training, cardio is just the mechanical movement in and of itself will help move food through. We see over and over again that the more you walk, the more you move in diverse ways, the less constipation folks tend to have. And this is, again, going to support that migrating motor complex of food through the digestive system. That's so important. All right, so and again, we want to think mechanics. So you really, like Dr. Rosalie was saying, want to slow down and chew your food. You want to think about taking really deep breaths, using your diaphragm to compress those abdominal organs, and having a strong core abdominal system, strong core abdominal muscles is going to help keep that compression happening throughout the day and moving and helping with the mechanics there. Here, one of the biggest pieces are musculoskeletal contributors to constipation is the puborectalis muscle. And as you can see here, there's a way in which if you're sitting, you're actually, which is the way that most of us in the Western world sit on the toilet, it's completely counterproductive to having a smooth bowel movement because you've pulled that puborectalis muscle forward, which kind of creates a little divot or dip in the colon there. But either squatting on the toilet or using this kind of squatty potty technique and leaning forward, you can engage your pelvic muscles and provide that alignment that you need to get the stool out of your colon.
So as far as our nervous system goes, that's our tip number 4. We kind of mentioned it earlier that stress impacts digestion, and it's absolutely true. If you're nervous, you might have constipation, or you might have a quick release, like a diarrhea episode. So we know that there's a direct brain to gut, we call it the brain to gut axis communication. And we know that if we can find time to de-stress, even meditate or practice mindfulness, that can help. It's critical that we take that time to acknowledge the food that's about to come in before us and try not to be eating on the run. Eating while you're in transit is really problematic for our digestive system. We also know that there are certain things that we can do, like massage therapy, chiropractic care, acupuncture, those body work pieces that are soothing to the nervous system, and those can help balance the digestive system. And then the vagus nerve in particular is one that is just absolutely critical. This is cranial nerve 10, and we can see it coming down from the brain, and it has direct input to all of these digestive organs. So it's going to affect this parasympathetic, this rest and digest, absolutely critical for our gut motility and our GI system to do its job. So if there's stress overlying in your life, we highly encourage you to do your best to get a handle on it. It's really challenging for a lot of people these days, and we're here for you if you need extra help in that support area. As far as this link, we've seen it once again in research papers. We see it with our patients. We know it individually that stress can really mount and affect the digestive tract. And we also know that there's a neurotransmitter link with serotonin there. So even stress that ends up showing up in the form of depression, anxiety, these are affected by this neurotransmitter that we've talked about in several other discussions, other doc talks. And we know that that directly impacts the digestive tract because serotonin is produced down in the GI system as well. So in the brain and in the gut. So we want to make sure that we're really taking time to acknowledge that. Ways that we can help our vagus nerve are, once again, trying to figure out ways to control your stress, taking time to really focus on your intestinal system, taking time to do that moment of acknowledgement for your food when it comes in front of us. We can also do certain physical things to stimulate that vagus nerve. One of my favorite is gargling. So having people, after they're done brushing their teeth, do a minute of gargling, having that be almost like a daily exercise to stimulate that vagus nerve is a really great one. Activating the gag reflex is another one. It's not quite so pleasant, but it's very effective. So for our patients who have major problems with intestinal motility, that can be a big one. And then also things like singing and humming and chanting. These are so core to us as human beings, and they directly affect our nervous system and have this ripple effect into our digestive system. Taking that time to do deep belly breathing is another component of this. And then, as Dr. Mary can attest, acupuncture can be another direct way to stimulate that vagus nerve. We also have research that shows us that cold exposure, just short bursts of cold exposure, like ending your shower in a cool spray, can be very helpful for the nervous system in regards to the vagus nerve.
So health hack number 5 to improving digestive complaints is to diversify the microflora. Okay, so that microflora is so key in digestion. What's so amazing to me is that, you know, of all of the cells in the human body, 1 part is human and 9 parts are bacterial or non-human, essentially. So those tiny bacteria, viruses, fungi function actually internally to help us hugely with digestion. So if we diversify that microflora, if we ensure that there's a nice difference of all of the different kinds, we are boosting our digestive power. Probiotics help, of course, though beware in SIBO, because sometimes they can be problematic. And then, of course, prebiotics as well, which is a new buzzword here, which means they feed the probiotics, and they're usually fibers, okay, which otherwise we can't digest, but our microflora can. Probiotics that we carry, we do have SIBO-friendly kinds, okay, and the ones that are helpful even in SIBO, that small intestinal bacterial overgrowth, are the lactobacilli and the bifidobacterium, okay. They help with preventing an overgrowth in the wrong place, but are still stimulating that biodiversity in the right place, which is in the colon. Probiotics also help with our gut-associated lymphatic tissue, which is a part of our immune system. So if you could imagine, there's a lot of the immune system that lives in the GI tract, and having a nice biodiversity of microflora helps the body not have an immune response to the monoculture, okay? one of the big things also, health hack number 6 here, is to think about fiber. So of course we think fiber, we think, all right, we're helping constipation, right? Helping move things through. That's our insoluble fibers. Those are the ones that don't dissolve in water and create some bulk to move through the body. The soluble fibers are also really important because these are our prebiotics, right? They feed our healthy bacteria. If our bacteria are healthy and happy, our bowel movements are as well.
So next we're going to run through some smart supplements and herbs to support digestive health. So some of our main ones that we use all the time are bitters and demulcents for different aspects of supporting gastrointestinal health. So bitters are one that we can take often in a tincture form, and you typically take them about half an hour before each meal, and the just dropping them on your tongue, and usually you kind of do half a dropper full, will stimulate the vagus nerve and start the digestive secretions prior to your meal. So if you try it, you actually can notice you get more hungry, which is great, and then you're ready to fully digest your food when you do eat it. It also helps promote peristalsis, which is useful for moving things through the digestive tract. Demulcent herbs are a primary tool we use when there's GI inflammation. So whether it's GERD or whether we're talking about gastritis or an ulcer type of situation, these demulcent herbs, including aloe, licorice, slippery elm, marshmallow, they're ones that have this mucilage to it, and they're soothing to those mucous membranes that get really irritated at times. Certain vitamins and minerals can be really helpful for promoting digestion. We know that vitamin C and magnesium help move things through. Antimicrobials are particularly important when it comes to treating SIBO and culling that overgrowth of bacteria. Prokinetics, again, really important for any kind of constipation. We use it very often in SIBO treatment. And those herbs include ginger and artichoke, and some of the bitters to help move things along. And then we've got probiotics and prebiotics and fiber. All right. So bitter foods is one way that we can actually stimulate digestion prior to a meal. So whether that's eating a salad with some dandelion greens, I love taking a handful of arugula before I eat as kind of a digestive bitter prior to my larger meal. And teas like dandelion tea, burdock tea, all of these are great to bring in when you're getting ready to digest. And then here are some these are the herbs that are in the carminative category and also have some antimicrobial action as well. So we've got oregano and rosemary and cardamom. And some of these are the ones we use most often for, again, their antimicrobial action. And then cardamom is particularly known as a carminative. So that's going to help reduce the spasming. So sometimes, we don't have enough of a migrating motor complex action, and sometimes our digestive tract is just doing this and causing a lot of cramping. So these herbs are helpful in calming that cramping and helping coordinate that movement. So this is an example of a demulcent herb I was mentioning before that helps soothe the digestive tract. Slippery elm is one that we use often. It comes in this kind of fluffy herb form usually. And you can, it's really versatile. You can mix it into water or add it to oatmeal or any kind of liquidy food. And it's a really great way to soothe irritated mucous membranes. All right, now we have the herbal antimicrobials. This is one of our main treatments we use in SIBO. So the main ones we're going to use are garlic, and it's actually an extract of garlic, because garlic can actually be problematic in SIBO, but when you take the fermentable sugars out of it, there's a compound called allicin that's particularly helpful with the methanogenic bacteria that cause constipation. High strength berberis, this is one of our main constituents that comes in a lot of herbs like Oregon grape and some of the Chinese herbs I'm going to discuss later. And then we have these other ones that we use, including neem and oregano oil and uva ursi. And in the SIBO treatment with antimicrobials, we like to use a variety of them to get a variety of constituents that are all acting slightly differently.
And we wanted to just include this slide for you guys, not to overwhelm you, but to just give you an idea that there are a lot of different antimicrobials out there that are natural. And we'll use these not just for SIBO, but also for other intestinal infections. So certain bacterial infections, even parasitic infections. And it's one of the reasons why seeing what's in Pandora's box and doing the stool testing for us can just be so very powerful, as we can figure out what microbes are there and then who herbally we can use as a helper to get rid of those, and hopefully not have to use pharmaceuticals if possible, because we find that these are much more gentle on the system typically. So we'll also use prokinetics quite a bit in our practice, as we've been talking about. Remember that migrating motor complex is just so important. We have to have motility. We have to have the stool moving through. It's an eliminatory organ, but it's also regulating our flora, which we just know is so very important. So there's a few different ways that we are using these clinically at Prosper. We'll often use something that has an herb in it, like ginger, which can be really helpful as a heating herb that helps with motility. And we'll also sometimes use something like 5-HTP, which helps that serotonin pathway, which I kind of mentioned earlier, that serotonin has receptors in the gut and can be very important for motility as well. So we'll often use these combination migrating motor complexes, supportives, and then sometimes we'll also use low-dose naltrexone as an option, or even low-dose erythromycin. So these are both compounded pharmaceuticals that we prescribe to patients if we need to get the gut up and moving. And remember, there's so many different reasons that motility might be affected. For some people, it might be a nervous system disorder like Parkinson's. So sometimes we need a little bit more oomph than, just simply, a beautiful herb like ginger. We have, of course, an apothecary here at Prosper that we utilize to really choose nice, clean herbs and nutraceuticals for our patients. So this is something that we access quite a bit for our patients who are in need of a more complex treatment strategies. And we, do our best as physicians to vet these to be really clean and effective physician-grade products. So we want to get a chance to really talk about some of these other really cool mechanisms for supporting digestion. So I'm going to have Dr. Rosalie and Dr. Mary talk about those.
Thanks, Dr. Molly. I know we're running over time here. You could tell we're really passionate about this topic. But what's pretty cool about Prosper is the fact that we've got some Eastern medical modalities on board with Dr. Mary's traditional Chinese medicine perspective and my Ayurvedic one. So I'll just run through briefly here how Ayurveda can be used for helping gastrointestinal disorders. So Ayurveda is the traditional medicine of India. It means in Sanskrit, the science of life, which is a pretty beautiful term. IBS SIBO in Ayurveda is what's known as Vishama Agni, which just means your digestive fire is not strong, okay, and alternating. And the root cause is this concept of high vata. And vata is our air and space element. If you can imagine it, the air and space is in the GI tract, causing bloating, burping, flatulence, etc. Okay. Generally, we treat high vata in the GI tract by decreasing it, by pulling from our earth and water and fire elements. Okay. We also want to increase our Agni, which is our digestive fire. So a lot of the topics we've talked about prior to help with digestion and those diet revamp is also applicable here. One of the big things, if things are not moving along, includes fasting and this panchakarma cleanse that happens in Ayurveda, which helps just push the reset button when the GI tract is not cooperating. Some of the herbs and treatment modalities from Ayurvedic medicine include some of these here on the screen. One of my absolute favorite recipes for building that Agni, that digestive fire, includes our hot ginger, right? We're increasing fire by using a hot herb. And you can thinly slice ginger, add a little splash of lime and a pinch of salt, and you could take 1 or 2 or 3 of these before your meals to boost that digestive fire. In terms of the Ayurvedic diet, remember we've got to diminish air and space and boost the fire. So one of the ways we know that we're ready to eat is we actually have clear burps prior to our meals. We're not burping up anything that's fermenting inside. Okay, so clear burps are an indicator that you're ready to fill up again. And we want to stop eating before we feel lethargic, right? So knowing those times are actually very important in Ayurveda. Avoiding cold water, right? Cold is going to diminish our digestive fire. And then eating fruit on its own stomach is a big role in Ayurveda. Fruit on its own stomach because fruit needs its own mix of enzymes. And then lastly, one of my absolute favorite treatments is the oil massage to the abdomen, which is known as Abhyanga. Okay, so we use our healing touch with our hands to give it to that GI tract and remind it that, yes, we are here for it. It is here for us. And we are also, helping give that message to all of our many million microflora on the inside.
All right, so thank you, Dr. Rosalie. So here we go with traditional Chinese medicine and the applications of IBS and SIBO. So in traditional Chinese medicine, the spleen is the organ that is responsible for absorbing nutrients and creating qi or energy and blood or nutritive substances. So it helps us get food from, it helps us digest our food and then use it properly. So spleen qi deficiency is one of our main patterns of digestive issues in Chinese medicine, and it is associated with bloating and burping and diarrhea, and just kind of your spleen is not working properly. The liver is associated with well, the role of the liver is to move qi and blood around the body. And when you're under a lot of stress, the liver just kind of stops doing its job, and it can even kind of bully the other organs or kind of cause too much qi in one direction or another. And so this pattern of liver qi stagnation is particularly appropriate when someone is having digestive issues that's much worse with stress, which you can see is a really common pattern in our culture. And then, like Dr. Rosalie was saying, in Ayurveda, cold is a major problem for digestion in Chinese medicine as well. So with eating too much cold foods like salads, or, you know, really in the winter time when you're not traditionally supposed to be eating these foods, or having ice water with a meal, you can cause this pattern of cold in the middle jiao, and you treat it by supporting the middle jiao or supporting the digestive fire, like Dr. Rosalie was talking about in Ayurveda, with warming, stimulating herbs. And then lastly, we've got damp heat in the intestines, and damp heat in Chinese medicine is often associated with some kind of infection and inflammation. And so we'll talk about that in the next slide when it comes to SIBO. So these three herbs are called three yellow brothers, and they are berberine containing herbs that are antimicrobial and stimulate digestion. So they're really bitter, very, very, very bitter. People hate the taste of these. And they're in Chinese medicine known as very cooling, and in Western medicine known as very antimicrobial. So from naturopaths and acupuncturists, these herbs are commonly used to kill the overgrowth of bacteria in the small intestine. And then similar to the Ayurvedic perspective, you want to eat warm cooked foods and use a variety of warming spices in your meals. So those are sort of the foundational dietary recommendations, although the dietary recommendations tend to be highly individualized based on a person's particular picture. And then lastly, we've got acupuncture as one of our main tools. And it's really great, particularly when there's a qi stagnation component. Again, that stress, kind of overactive mind, just feeling like your body is out of sync. Acupuncture is a really great way to treat digestive issues in those conditions.
So that is the conclusion of our talk today, but we want to make sure we go through some of the questions that were asked via the chat. And also we want to just make sure you guys all know you're invited to our October Doc Talk, which is going to be on blood sugar balance and weight optimization. So let's make sure to kind of put that on your schedule and sign up for it when it comes out as far as a registration link. And we also just want to invite you guys to set up appointments with us if you have questions and if we can help with your individualized care. I'm looking through the chat here and I see that there's a question about the digestive process. And we talked quite a bit about chewing today. I know it seems so basic, but it's one that gets quickly overlooked in our culture. So the question is how is chewing and the digestive process impacted whenever we're having smoothies? So if we're having fruit or vegetables in smoothie, how is that impacted if we're getting it pre-blended? And this is interesting because it's kind of coming in a pre-digestive form by being broken down mechanically by those blender blades, but by not having our saliva coat that and taking the time for our saliva to go in and start breaking down the starches from those fruits and veggies, sometimes, especially a cold smoothie, might not sit well for people, especially if they have that lower, a digestive fire. So we do want to take a moment with the smoothie, kind of swish it around in our mouth a little bit and take it and acknowledge those drinks that we're having. Also, it could be argued that some people won't do very well with fruit blended in with other things because it does require its own set of digestive enzymes. So perhaps removing fruit from your smoothies, if you're somebody who struggles with digestion, would be one of my first thoughts. Let's see what the rest of the physician care team here has to say about that.
So I second everything that Dr. Molly said. And I think, from a traditional Chinese medicine perspective, it's helpful to kind of eat with the seasons. So you know, smoothies are great. You can put so many amazing things in them, but sometimes they're actually kind of cold and have a lot of, you know, fats mixed with fruit, and they can be kind of rough on your digestion at times if you're someone who's struggling with digestion. So you really want to just kind of pay attention to your body and see if you are digesting it well, or is it causing any issues, and kind of consider having it in the summertime when things are warmer and your digestive fire is more prominent.
Yeah, indeed. I third that. I think from the Ayurvedic perspective, again, fruit is you know, is part of it, the incompatible food combinations. So there's a bunch of rules in Ayurveda that say you can't have this with this because the energetics are opposite. Basically, in Western medicine, it's just the enzymes needed to digest the fruit are very, very particular. And then from the veggie perspective, veggies are cooling. They're very cooling and can actually diminish the digestive fire if you're having a cold smoothie. That's why in Ayurveda, you see a lot of heated up veggies, be it sag or soups. So from an Ayurvedic perspective, cold fruit mixed with cold veggies is actually a no-no.
So we just want to thank you all for taking this extra time today. It's just such a packed topic for us. And we look forward to seeing you guys next time. So we hope you have a great beginning of your fall here over the next month. And I hope you are all well.